I'd like to talk about and introduce Young SIOPE to those of you who do not know it yet. I'd like to share with you who we are, what the aims are, and also what kind of projects we are currently working on. Yes, so Young SIOPE was launched in May 2019 in Prague during the first SIOPE meeting. Today we have approximately or slightly more than 200 members on our mailing list, which is really great. And we have a steering committee with 7 members. And most of us are also present during this call. And as Thierry already said, if you have any questions after this short talk, just ask them in the chat or ask them directly. Young SIOPE, what's the idea? The idea of Young SIOPE is really that it's a format for the young members within the European pediatric oncology community. It is the aim to foster a closer community within the young members, but also to shape the education so that we can also kind of contribute to our own education. The aim is also to facilitate the involvement of young members in research, and also to facilitate involvement of the young members in clinical trial groups already at early stage in their career. And lastly, and I think this is a really important point, to also connect and to learn from the giants, meaning from those pediatric oncologists which are for years and decades already in this pediatric oncology community. But I think it's also important that probably they can also learn a little bit from us, so from the young input and new initiatives and new ideas. Within Young SIOPE, we kind of have 3 main pillars, and to each of these 3 pillars, we have 2 to 3 steering committee members assigned, which are kind of responsible that each of these projects is running. But it is really important to state that within each of these projects, we have, of course, additional Young SIOPE members involved, which really actively participate in these projects. We have on one side the education, which is led by Rudolf and Teresa. We have the early career clinical trial group involvement led by Nicolas and Erika. And we have the Essential Medicines project, which is led by Eva Brack, Reineke, and myself. And in the next few slides, I would like to give you a bit more deep insight into these 3 pillars, starting with the education project. And here we have the Young SIOPE webinar, of course, that's the one you're participating in this evening. And we also have webinars in collaboration with ESO. And there, Teresa and Rudolf also have support from additional Young SIOPE members from Maria and Paula. We have an additional monthly interactive webinar in collaboration with ER and PetCan. And the aim of this webinar is to discuss difficult clinical cases. And the idea is that these difficult cases will be presented by young oncologists, so maybe one of you, and that afterwards these presentations will be followed by a live discussion with experts in the field. A 4th education project, and that's a really great one, is the first SIOPE Europe course in pediatric oncology. And it is a course that takes in total 3 years with a 4-day module every year. And besides learning about clinical aspects of childhood cancer, the aim is also to learn about, for example, research methods, about statistics, statistical analysis, but also to have or to build up collaborations and to learn about leadership and about patient management too. And here Reineke is the co-chair of the course, and Rudolf is also involved as a Young SIOPE member. For the 2nd pillar, the SIOPE Europe Early Career Clinical Trial Group involvement, led by Nicolas and Erika. This project is also supported by an additional Young SIOPE member, by Emma. And this is mainly kind of a mentorship program, which is now open for recruitment. And just to really give you a very, very brief idea about this project, it is the idea that Young SIOPE members can apply for this mentorship program. And on the other hand, we have mentors from the clinical trial groups. And then we have kind of a mentee pool and a mentor pool, and the young SIOPE coordinators then match these mentors and mentees. And it's afterwards really the idea that this pair of mentor and mentee, that they kind of have a kind of longer follow-up, that also the mentor introduces the mentee, for example, in the group, in the research, in this specific type of childhood cancer. And here it's kind of written that it's thought to be then a follow-up up to 5 years. But of course, the idea is that all these connections will last for much a longer time. At the moment, we have also two kind of concrete tumor groups where really the active involvement of young members is kind of asked for. One of them is the SIOPE renal tumor study group, and this is a cooperation which is currently building up between Europe, the US, Brazil, and China. And this cooperation is really keen to involve young investigators which are especially interested in renal tumors. And on the other hand, the young members have the opportunity for the involvement in this specific type of childhood cancer, and also to be engaged for a longer time. And as I said, this program is at the moment kind of building up, but we already have a liaison between young SIOPE and the renal tumor group, and this is Christa König. And then we have a second tumor group interested really in the active involvement of young members, and that's the expert group. And there we have the really great opportunity that a young member can join the board of the expert group. It's kind of then asked from the young member to attend and contribute regularly to the board discussions for a term of 2 years. And now if one of you participating in this webinar now is interested in this board position of expert, you can also contact the SIOPE office, and I will provide you with the email address afterwards. And now the last kind of pillar of essential medicine of young SIOPE is the Essential Medicines project. And here the primary aim of this project is to provide an updated evidence-based reference list for essential anti-cancer medicines to treat pediatric cancer in Europe. So the idea really is, when this project is finished, that we have a list of drugs where we can say these are really essential. They have to be available 24 hours a day, 7 days a week for every child within Europe. And here we have many more members working on it. We have 35 young SIOPE members working in this project, and we have 21 mentors from the clinical trial groups, and they're assigned to 16 different tumor groups. Second, kind of secondary aims of this Essential Medicines project are, on one side, to contribute also to the next revision of the essential medicines list from the WHO. And secondly, to initiate a dialogue with the health technology assessments on the evaluation of newly approved expensive anti-cancer medicines for children. And there, for example, one of the aims is to look where might be the delays between the approval of a new drug for adults until it's approved also for a pediatric indication. And that's already the end. So you see the mail address in case that somebody of you is, for example, interested to become a new member of Young SIOPE if you are not already a member. If you are interested in the newsletter, that's provided approximately 4 times a year. Or if you would like to join actively in one of the initiatives, or if you have kind of an idea about the project, but for example, you are missing manpower, or you need, for example, information from different European countries. And lastly, also, if you're interested in this board position from the expert group, you can also find us on the internet, and we also have a tag for Twitter.
Many thanks, Maria. This part was not about advertising everything that we do, but it's really about inviting you all to join if you're interested, because as you see, there is tons of different activities going on, and there are more to come. So we are growing, and there is a need for more engaged, for more hands to tackle all the activities. So go ahead and join us.